Okay, so let's dive a little deeper, shall we? We talked about the cause of sepsis being possibly a fever, infection, or sepsis. We talked about hemorrhaging and shock. Now remember, if it's a hemorrhage or it's shock, then of course you're going to have to do a lot with that patient. Obviously, blood transfusions may treat that tachycardia because it treated that anemia and that hypovolemia that your patient was experiencing. When it comes to shock, you must remember that because all shock has a low BP, we know that no BP equals no PP, which means no blood pressure, no blood perfusing kidneys. So all shock with its low blood pressure, and some shocks, of course, have tachycardia. When it comes to treating shock, you've got to keep that blood pressure up. So you may need what's called vasopressors. Vaso is vessel, pressors is pressing the vessel. What did you do? You vasoconstricted the blood vessel. And you know if you vasoconstrict a blood vessel, it's going to make the pulse and the blood pressure go up. So in this patient's case, with regards to shock, if you don't use vasopressors like norepi and we call it Levophed, leaves them dead, the first priority with that patient is always going to be volume of fluid. Fluid controls your blood pressure, and the volume of fluid that you administer to the patient through IVs should bring that blood pressure up and save that patient's life should they be in shock. So recap, right? Treat the cause of the tachycardia. Was the cause a fever? And was the cause of the fever sepsis or infection? Then antibiotics, triples if it's a sepsis. If it, of course, after a workup. If the cause was hemorrhage, then blood transfusion, right? Yeah, treat the cause. If the cause was shock, then you're going to have to give IV fluids or volume expanders as well as maybe vasopressors. So you feeling me on this? I think we got this. We even talked about if the cause is anxiety or panic attack or whatever, well, then a little Ativan or benzodiazepine would make sense here. Or coaching the patient, breathing relaxation techniques. But remember, if the anxiety is causing the tachycardia, then the source of the anxiety, which is the source of the tachycardia, might be pain. Don't forget to assess your patient for whether or not they're in pain, because a lot of patients are in so much pain that they're getting freaked out about it, and you'll notice it because the tachycardia will be there. Who does that? Your babies. Remember, you got to know pediatrics. Babies will show pain through tachycardia. All right, are you ready for more? Because I got more. Next, for the cause of tachycardia is those damn substances. Oh, I'll be back.